Hi, it's Dr. Rohde. Today I really want to talk about something that I think is important for many people in our society because it's something that's really affecting more and more people, and that is thyroid disease, both underactive or hypothyroid and overactive or hyperthyroid disease. And then under those categories we also put in autoimmune thyroid disease. So we want to start out with understanding when you do lab work. Most doctors will order a TSH, and a TSH is thyroid stimulating hormone. And that tells you one specific function of thyroid disease, but it doesn't tell you a lot about the other functions of the thyroid. So I want to go back to that little picture so people can understand exactly what we're talking about. So we have the hypothalamic pituitary thyroid axis, and the hypothalamic and pituitary glands are in the center of our brain, and they literally produce hormones, the thyroid releasing hormone, which tells our pituitary to produce thyroid stimulating hormone. Thyroid stimulating hormone stimulates the thyroid and does exactly what it does. It tells the thyroid to make T3, T4, also some T2 and T1, which we don't really measure. But as the T3 and T4 increase, then what happens is there is a negative feedback loop from the T4 in specific, and that slows down the release of these hormones, and so it's a negative feedback loop. So TSH, when it increases, it tells us that it's telling the thyroid, hey, work harder, and the thyroid might not be able to work harder because of hypothyroidism, but more commonly now toxins that are stored in the body that prevent it from working as well as it can. And so as the TSH goes up, it tells us the thyroid gland is unable to do that. Conversely, if your thyroid is hyperthyroid, then it will send this feedback loop down and your TSH will become really low. Similarly, if you're on medication, you get this feedback from the medication and the TSH decreases, and so it allows us to check where the levels are at. Most doctors check a TSH, and if that's normal, they assume that the thyroid gland is working properly, but then some people don't convert well from T4, which is an inactive hormone that's made by the thyroid gland in your neck, circulates around in your bloodstream, and it has to be converted by the liver and the kidneys when it's absorbed into the tissue to T3, which is your active hormone. All of this is again affected by the other hormones in your body as you change or adjust hormones, say looking at adrenal glands, say looking at your female or male hormones, as the case may be. Those are going to have an impact on these things as well because there are other feedback loops that tie to this. And then lastly, going back to gut health, again, what you're eating ties back to the effect on those as well, and so this ties together with this. So again, we go back to a healthy gut, especially if we start to talk about autoimmune disease of the thyroid, which the most common is hyperthyroid autoimmune disease or Graves' disease, and the other being Hashimoto's, which is underactive thyroid disease. And both of those indicate that your gut health is off, because 80% of our immune system literally resides in our gut. So it starts to become a little more involved than just looking at a TSH and saying nothing's wrong with your thyroid. And that's been my frustration when I see people that come in and said, I'm tired, but my doctor told me my TSH was fine or my thyroid was fine, but they don't feel well. And I guess I've been accused by some thyroid specialists of being Dr. Feel-Good. And if it's bad that my patient should feel well or feel good, then I'm guilty as charged. But looking at just a TSH and saying nothing's wrong when the patient is telling you, my hair's falling out, my weight's a problem, I can't get it off, and all these other problems are going on, constipation, I mean there's a long list of low thyroid conditions as well as increased thyroid conditions, then you need to start digging a little bit deeper, and we really need to look in particular at gut and diet as we're looking at the autoimmune diseases, but those are also affecting traditional thyroid function. And then lastly, we start to think about toxins. If you think about toxins in our environment, some people like to drink Mountain Dew. If you read the ingredients in Mountain Dew, it has brominated vegetable oil in it. Bromine is actually a thyroid toxin, as is chlorine. And so thinking about what you're exposed to on a daily basis, as far as your environment, can affect your thyroid hormone and your male and female hormone function as well. So many times we need to look at toxins that we store in the body, because some of us don't detoxify well, and I include myself in that, because I have a genetic chromosomal abnormality that my parents blessed me with, and I'm not able to detoxify well, so my body tends to hang on to toxins. So this becomes a pretty complex topic when we start looking at gut, we start looking at thyroid, we start looking at female hormones and adrenals. But that's really what you need to do to get a full picture of how your thyroid gland is functioning to get you back to optimal health, where you can live your best life. And that's really our goal, is to help you get back to living your best life. And if I can help you with that, if you continue to have issues where you're not feeling well, your weight's a problem, your hair's falling out, fingernails are brittle, you're constipated, all of these things tie together. But we need to look at all of these parameters to really get a good understanding of what's going on in your body so we can help you feel your best. If I can help, give me a call, drrohde.com, drrohde.com. Thanks.